What's up, Smashers? Look at this. I can sit here. You don't know what I'm doing, but I'm sliding back and forth on a rower. These things are great. I can just sit here and rock back and forth. So we're going to be talking about hip impingement. You know why? Because my friend Brian has some funky leathery hip capsule problems. So we're just going to talk about it because I said in the office he's also not only a good friend, but he's a patient. And I said, well, heck, why not make that the video of the day? So we're going to be talking about how to peel out the joint capsule. So we're going to bypass all the tissue restrictions per se, like the rectus femoris, all the internal external rotators, the gemelli, the piriformis, the obturators, all that stuff that's in there. We're going to bypass all that, not worry about the rotation, and more or less worry about that capsule being thick and leathery and not very mobile, and how to peel it apart, how to open it up, and how to clean up those hips super easily. And I'm going to show you how to do it with 3 simple moves. And they're 3 simple moves that I've shown you before, but I don't think I've chucked them all together. So we're going to just smash them together, SmashweRx style. See, the problem is you can unglue all the tissue minus the joint capsule, and you're still going to have problems with the hip. I know I'm walking around like this. How about I just do this? You can unglue the tissue so you restore the sliding surfaces. The problem is if that joint capsule stays super thick and leathery and super tight, it's going to take the head of that. So remember, your femurs sit like this, right? And your pelvis kind of bobbles around on top. If that joint capsule's super tight and not very forgiving and doesn't allow for that rotation, the joint ratchets inside. So now you're going to do your squats and you're going to grind away on that joint. You're going to do your cleans. You're going to do anything that involves moving and engaging the hip. And you're going to rip that labrum apart, you're going to grind away the articular surfaces, and you're going to wind up going in and seeing somebody for a hip replacement when you don't need one. And I've seen it in my practice when somebody that's 37 years old walks through my door and they go, oh, you need hip replacement. It's not because the hip is decayed, unless there's a disease process or an injury. And I put that caveat in there because that's a whole different world. But if it's neither one of those, it's a mobility restriction problem, and that beats the shiz out of the joint. So what we're going to do is we're going to unglue that joint capsule. Remember, it winds up. The fibers wind up super tight in external rotation, right? So we want to ensure that that's something you can accomplish. So if the tissue is really restricted, if that joint capsule is really restricted, you can't wind it up. So it just stays super leathery, and it just has a little bit of rotation in it. But in doing so, it restricts the movement of the hip. I know you can't see the hip, so I could jump up so you can see it. But anyway, so what I'm going to do is show you how to do that, and we're going to restore some of that internal rotation and external rotation all at once just by peeling away that joint capsule. Now, this is not one of my favorite stretches. It should be, because it's one I need to do a lot of. But number one is, you can see I have a band anchored right here. Now, I'm going to be throwing my knees on this, so pardon my pain face that I guarantee you I'm going to show you. But we're going to take this, we're going to cinch it around, do my little shimmy slide, but we're going to cinch it around the ASIS, so anterior superior iliac spine, so part of the hip. We're going to take the feet, we're going to rotate them out, and then all we're going to do is flatten out the back, and we're going to let it drag us backwards into whatever it's cinched up against, the rig, a tree, it doesn't really matter. How long do we hang out here? 2 minutes. That's number one. When you come out of this, push forward, bring one leg in, bring the other leg in, because you know what? It's a pretty crummy stretch and it hurts a lot. So that's number one. Now, if I pull down my shorts by accident in the video, I'm not going to edit it. It just stays like that. That's number one. Number two is you're going to flip this around. I need a plate. A plate you're going to use to stabilize the leg so you can put some rotation in it, because we want to restore the internal rotation. If you don't have internal rotation of the hip, think about what happens. Your stride length in your run or even a lunge gets really short, because the back leg, as it comes back, has to internally rotate at the hip to accommodate the joint and the mechanics to accommodate a wide stride. So if your stride is really narrow, and you start to get a lot of hip issues and an impingement feeling, it's probably because your internal rotation, well, stinks. So your glute's going to wind up getting inhibited. So you're going to wind up using one side more than the other, and that hijacks all your mechanics. So what you want to do is step in to a band. You're going to cinch it up right at the base of the glute. Okay? Now this plate is what you're going to use as an anchor. You're going to crank your leg into internal rotation. So you can see I've got it in internal rotation. And all you're going to do is you're going to get up really tall, take this leg, brace it out, and let that band drag you forward. So all I'm doing is I'm squeezing my glute. I'm staying square to the rig. This is torqued internally. The plate is keeping me there. And all I'm doing is blowing a hole open in my hip right here and peeling that anterior joint capsule. It's all thick and leathery, opening it up the way it's supposed to be. That's number 2. Number 3, way simple, way simple. Check this out. We're gonna do the wall squat, and we've done this one just the other day, but it's that important. So I'm gonna show you again. So we grab a band, cinch it around both knees, and you've seen this one, so I'm gonna get about 8 to 10 inches away from the wall. I'm gonna make sure the feet are toes forward. You can thank my friend Denise for that. She reminds me of stuff like that all the time. If you don't follow Denise, by the way, give her a follow. I'll throw a tag in her in this Instagram so you can see who it is. You're gonna go up like this. Like I said, you can be in an overhead squat position now. This is great. My knees are out. I want you to get your hands between here. Push those hips apart like you're trying to rip tissue. Like you want to get to that point where there's almost, you can see there's a little tear coming down here. This is going to restore a lot of that external rotation and the ability to abduct the hips. So move away from that center line, move away from that midline. And you're just going to camp out like this until you feel like you're about ready to toss up a boot. So honestly, this one, 3, 4, 5 minutes, hang out like this. You might feel it high in the hip on the front side. That's because it's working a little bit on that TFL as well. Hang out, camp out, unglue the hips. When you're done, give yourself a toss forward. That's how you get out of this, because I promise you this, that hip's gonna be super pinchy and super yucky for about 30 seconds after this. And then you're gonna feel like a ninja, just super, super supple. Hey, I'm Trev, SmashweRx, on the fly hip impingement reduction, rotation repair, restore the hip mechanics. It's just that easy. Coming at you on a Thursday. I'll catch you guys tomorrow. Have a great day.